Dr. Funke Afolabi-Brown, and
Mhm.
the founder of the Restful Sleep Place. And we really talk about making sleep a thing. So happy to have you here, Dr. Artani. Thank you so much for joining us.
Thank you for having me. I'm excited to be here.
Yeah, absolutely. So maybe we start with you, just maybe introducing yourself. Tell us a little bit about your background, what brought you here. Why are we having a conversation?
Yeah, of course. So my name is Dr. Artani. I am based in South Brunswick, New Jersey, which is a little north of Princeton. And I've been practicing dentistry for a little over 10 years now. I started as a general dentist. I did a residency and I did the whole grind for many, many years. And then I kind of delved into the world of airway and sleep dentistry. I took a lot of, CE things that are not really brought up in dental school, and we're not taught to diagnose and look for as traditional dentists. So I went down kind of the airway rabbit hole, and fast forward 10 years, I have my own practice now, and it's airway focused. It's a holistic dental practice that really focuses on prevention and getting to the root cause of disease rather than just treating symptoms like cavities and dry mouth or things like that.
What is holistic dentistry? Tell us a little bit about that.
So, if you Google it, you're going to get a million different answers. In my eyes, holistic dentistry is really looking at the mouth as a part of the body, not
Mm,
isolating teeth and saying, this is your mouth, this is the rest of your body, but really looking at the connections between what's going on in your mouth and how it's connected to or affecting what's going on in your body. A lot of times people are trying to heal a certain disease, or they're trying to deal with chronic inflammation or whatever it is, gut issues that may or may not be diet related. And they've tried everything. Like, I've been to 12 different doctors, I've seen every specialist, I've tried everything they've told me, and nothing's working. And oftentimes we forget that everything starts in the mouth. That's the only way, one of the only ways in, right? So if there's disease and disharmony and a disbalance in your mouth, chances are that's one of the underlying causes of what's going on in your body. And you have to address that in order to get to that healing.
mhm, mhm. Now, and I just love that. It's not just looking at one organ. And I think that's the problem with a lot of specialists, right?
Hmm.
Is sometimes we become, because we know so much about that organ system that we specialize in, we become very siloed in our approach. And this is what I tell
Hmm.
our patients when I see them. I'm like, I'm the expert of sleep. You're the expert of you. Now you're seeing an ENT doctor, you're seeing a lung doctor, you're seeing all these doctors, but it's still one you. And so
Hmm.
when we bring it all together to say, how do we approach this system with the lens of wholeness, with the lens of looking at the entire human being, magic
Hmm.
happens, right?
Absolutely. Yeah.
Yeah, yeah. And I think one that leads me to my first question, which is why and how is sleep and oral health connected? Because it's becoming a thing now and it's super exciting. But what are your thoughts? What have you seen from the work you've done for over a decade and now you're, in your own practice and things? What are you seeing?
Hmm. So I think dentists are one of the first people who can diagnose what's going on, right? Because the signs are in the mouth. Whether it's an adult or kid, something as simple as seeing very crowded teeth, right? That's one of the first things I assess. Where are the teeth positioned? How large is the patient's tongue? And how much of their throat can I actually see? Their throat tells me like their airway, right? When they open their mouth and all I see is a big tongue, I wonder, okay, are you snoring at night? Are you grinding your teeth? If they're grinding their teeth, I see it right away. A lot of people have flattened out teeth completely, and they're like, oh, I'm waking up with headaches. I have migraines all the time. I wake up tired. Or they'll come in with something as simple as, oh, my gums bleed a lot,
Mm,
right? Bleeding gums can be a sign of obviously periodontal disease or underlying like bacterial issues in the mouth, but it's also one of the main signs of sleep disordered breathing and a possible risk factor for sleep apnea. So, as a dentist, I obviously can't diagnose if they have sleep apnea, which is why I love to collaborate with doctors like yourself because I feel like the patient is coming in with different pieces of the puzzle. And now we all have to work together to make them whole again, make them feel
Yeah.
like themselves again, and not kind of dismiss what other doctors are saying, you know?
Mhm.
So I work with functional medicine doctors, I work with myofunctional therapists, we're getting into sleep, chiropractors, like they're all so interconnected. And
Mhm.
if we weren't on the same page, it would be that much harder to treat our patients.
And it's the patient that suffers.
Yeah, definitely, all the
Yeah,
time.
yeah, yeah. So maybe walk us through, and I know you mentioned a few already, and I just want us to go through that. You know, one of the
Hmm.
things you said, and this is something I observe, and I tell my dental colleagues that you guys are like frontline, right?
Yeah.
You know, the pediatrician, if it's a pediatric patient, is getting maybe 20 minutes of time with that child. They're talking through immunization, growth and development, so many other things, and
Hmm.
maybe they get a chance to look in the airway, but they're not spending much time there.
Hmm.
As dentists, you're there, like you literally are there
All the
the
time.
whole time,
Yeah.
meaning that there are things, and of course, you're seeing this, like you have been doing this for over 10 years. You have
Hmm.
seen a number of airways. So you could
Hmm.
tell what is not normal, what is normal, what is not normal, and even the progression. And I
Hmm.
know you see, kids and adults in your practice. So maybe walk
Yeah.
us through, like in a child, what are some, symptoms that a child might present with? And what are
Hmm.
things you're seeing in the airway? And
Hmm.
then for an adult, what are symptoms, things that they come in and maybe they tell you, and things
Hmm.
you see? And I think that would really start to help, folks that are watching this say, oh, I got that. Oh yeah, that too. Oh, ooh, I got
Yeah.
that, right? Like, so they can really start to get the
Yeah.
help they need. Yeah.
So for kids, one of the biggest signs is mouth breathing. Mouth breathing
Mhm.
is not just an indication of an airway issue, but it's also the primary cause of cavities in kids.
Mhm.
So while I'm looking at the teeth, and if I'm noticing, hey, there's like a cavity on every single tooth, mom is telling me she helps, her kids brush their teeth. They're using all the right products. They're coming in every 6 months. They're literally doing everything they're being told. But why are we running into this issue?
Mhm.
So mouth breathing will often be associated with enlarged tonsils or adenoids. So the minute I just see like the profile of their face, like mouth breathers just have a different skeletal structure, especially kids. Um, Oftentimes they're narrower, their jaws are narrower. There'll be kind of some deficiency in the midface, that requires them to breathe through their mouth. They may constantly be stuffy. Their nose comes in. I lean them back. I take a quick look at their nose and they're fully congested, which would explain the mouth breathing to begin with. So then when you see the mouth breathing, you see the enlarged tonsils and adenoids. The next thing I ask about is how are they behaviorally and how well do they sleep, right? Those are kind of my first signs. In the mouth, a lot of times I'll also see their narrow palates or very high palates. Like when you lean them
Mhm.
back, their palate is all the way up. And oftentimes, what people don't realize is the four of the nose and the roof of the mouth is the same bone. So if your palate is all the way up there, how much space do you have to breathe through your nose, right?
Mhm.
Um, so that's another thing. And then the last thing we look at is the tongue. The tongue is a huge, huge muscle that's really overlooked by a lot of dentists. And proper tongue positioning is one of the easiest ways to resolve a lot of the dental issues and sleep issues in the early stages. So I look, is their tongue fully mobile? Do they have a tongue tie? How is their tongue posture? Since the tongue is a muscle, it's no different than any other muscle in the body. It has to be exercised, it has to be used correctly, it has to be strengthened. And a lot of times we notice kids have very low tongue tone and they're mostly hanging with their tongue down or hanging out of their mouth because they're mouth breathers, right? So all these little pieces kind of come together and we say, okay, this is you're checking off all the signs, I highly encourage you to go get a sleep test and see if there's a diagnosis behind this, right? Because most times when you get into it with the parents, they'll be like, oh, yeah, my child definitely wakes up tired, or
Mm-hmm.
it takes him or her a while to get going in the morning, or even little things like tantrums, right? Like to some extent, they're normal in kids, but to some extent, it's past that normal limit, right? Where it's really hard to just get anything done. It takes so long to just get out the door in the morning. So these are all things we're looking for. In adults, we're looking for the same things, but oftentimes adults self-medicate, right? So
Mm-hmm.
pop ibuprofen, get some coffee on the way to work. So we really ask how they feel throughout the day, which is an indication of how well their sleep was, right? Some will say, oh, yeah, I was in bed like 12 hours last night, but how good was that 12 hours of sleep? Did you get like 2 good hours of sleep in that 12 hours where you went bed? Or was it a legitimate, like, 12 hours of good restorative sleep at night? So, same thing for adults, we look at crowding, right? Teeth is not just about alignment, it's telling us how much space there is for your tongue. Tongue posture, again, is a big thing. And just assessing the other muscles, right? The muscles of mastication here, which is where most common with headaches in the morning, um, and jaw pain with their grinding their teeth, also ear pain in both adults and kids. Kids with recurrent ear infections, right? Some moms come in and be like, yeah, my child has had like 4 ear infections this winter. Like, that's not normal. That's a skeletal issue. There's not enough drainage, and that's because of the jaws. So everything kind of comes down to airway and jaw growth, development,
Mm-hmm.
all of that.
Yeah, yeah. I love how you've walked us through this. So, one quick question,
Mm-hmm.
because this teeth grinding is a big one.
Mm-hmm.
Two things actually, too. One is the mouth dryness, the cavities,
Mm-hmm.
right? And I love what you said. I've had people, and I have people, dentists also actually tell me this. Like, it makes no sense. This family does all the right things, yet
Mm-hmm.
there's a mouth full of cavities. Where is that coming from? So, do you think it's really because of that? Like, their mouth is open because they're chronically mouth breathing, and so the saliva is, it's dry, and so because of that, they're more at risk of cavities? Or what are your thoughts? Because we've looked at this to some degree in research, but
Mm-hmm.
there's not that many studies that have
Mm-hmm.
looked at specifically increased cavity formation. So for anybody out there that's listening or going to watch this again, if you're like a researcher, a resident, a fellow, even a medical student interested in exploring this, please reach out. Really looking at that to say,
Mm-hmm.
what if we take all these kids and just study them and see their risk of sleep apnea, especially if they don't have risk factors? Like, it's a
Mm-hmm.
different case if you have a child who's falling asleep with a bottle in their mouth, or
Yeah.
taking candy and gummies and stuff like that to bed. No, they
Mm-hmm.
have pretty good oral hygiene. So maybe I just want to hear your thoughts.
Yeah. So for me, it's not kind of one single thing we can
Yeah.
pinpoint, right?
Mhm.
Hygiene is one thing. We kind of rule out one by one what could be the
Mhm.
main cause, right? If we can check off hygiene and the things they're doing at home, then okay, we know that's probably not caused
Yeah.
by this. The next is diet. It's not always
Mhm.
what you're eating, it's the frequency of what you're
Mhm.
eating, right? The pH in your mouth, resting pH, that's also a huge contributor. If the pH is frequently acidic, then you're more at risk for decay.
Mhm.
Another huge thing is the bacterial composition, right? The oral biome. Um, this is really common in adults who go to the dentist every 6 months and they're like, every 6 months I have a cavity. And they're doing it, right? They're doing everything. So that's where we get into saliva testing.
Mhm.
We do that, and that tells us exactly which bacteria are in their mouth. And I can't tell you the number of times where it's been the concentration S mutans, which is the bad bacteria that contributes to cavities, through the roof, through the charts, right? Like the
Mhm.
bacteria is so high, their oral hygiene is impeccable. They're eating the right things, they're hydrating, but there's a imbalance in their microbiome, right? So it's like fighting an uphill battle. No matter everything they're doing, the bacteria is just off. And that again goes to mouth breathing and diet and also supplements, right? What are you deficient in? What supplements is your body lacking? Which minerals is your body lacking? Um, but usually a common kind of theme in all of these is mouth breathing and not adequate nasal breathing. So there are mouth breathers that don't have cavities, right? It's not like if you're a mouth breather, you're going to have cavities.
Mm-hmm.
But in the ones who do have cavities, who do have consistent recurring cavities, consistent problems coming over and over, mouth breathing is one of the common things in all of them.
Mm-hmm. Mm-hmm. Now, how about teeth grinding? Do you
Mhm.
tend to, what are your thoughts as to why that occurs? So, my experience is we'll see it in kids or adults
Mhm.
who have sleep apnea, and it's almost
Mhm.
like this stress as they're having those obstructive events. That's a
Mhm.
possible reason. We'll
Mhm.
also see it in kids. I see it especially in children with ADHD and adults as well, with maybe anxiety, a lot of
Mhm.
stress, and things like that. Is it similar to, the kind of mouth breathing and maybe or not they have cavities and oral microbiome? The teeth grinding, are you seeing multiple reasons contributing to it, or what's been your experience?
Um, Teeth grinding is it's either or usually. Either they're
Hmm.
mouth breathing or they're teeth grinders, right? Which makes sense because they can't grind
Yeah.
their teeth if they're sleeping with their mouth open. Um, Teeth grinding is like more recent studies have indicated
Mhm.
one of the earlier signs or risk
Mhm.
factors of sleep disordered breathing
Mhm.
and teeth grinding because these muscles of mastication are so close, they're easily fired, right?
Yeah.
Even during sleep, even when you're not fully awake. And that kind of muscle contraction is keeping the blood flowing, keeping the oxygen coming to your brain, which is what sleep apnea is like dips in oxygen at nighttime while you're sleeping. So there's been a lot of research and studies I've read up on. Nothing that's kind of said if you're grinding, you have sleep apnea, not
Mhm.
that kind
Mhm.
of like, correlation or causation. Um, but I view it as a risk factor, right?
Mhm.
If we see risk factors, do we want to wait for a problem or do we want to address it early on? If I see you're wearing down your teeth, do we want to just say, hey, let's wait and see until you don't have teeth anymore? Or let's figure
Yeah.
out what it's causing it, how we can correct it, right? A lot
Mhm.
of times these teeth grinders are very crowded. The teeth are really
Mhm.
close together and the tongue is really large. So again, it
Mhm.
leads to, is it an airway thing, right? Is it an
Mhm.
airway issue and is there some sort of sleep disordered breathing or sleep apnea diagnosis underlying? So at times like that, I almost 100% send to a sleep doctor and say, let's get a
Mhm.
sleep test and get more information, right? The more information we have, the better we're able to come to a diagnosis, the better we're able to treat what we know what we're up against.
Yeah. Yeah. Now, we've talked about risk factors. We've
Hmm.
talked about signs and symptoms. I
Hmm.
love that you mentioned the oral microbiome, and I love this your approach using sort of that holistic lens, like saliva
Hmm.
testing, looking to optimize that microbiome and things like that. And
Hmm.
now maybe fast forward, they've done a sleep study. Looks
Hmm.
like sleep apnea. I mean, if the general, consensus is, if the tonsils are big, adenoids are big, maybe they'll see the ear, nose, and throat doctor to get that fixed. Sometimes that may work. Sometimes that's not the issue. Sometimes
Hmm.
it's really what you said. Facial development has led to changes, and in
Hmm.
some situation, alternative treatments are recommended. In
Uh-huh.
adults too, sometimes, it's CPAP or, weight loss strategies or positional therapy, but other times alternative treatments, either oral appliances, maxillary expansion, are things that we start to talk about. So
Hmm.
maybe walk us through some of those treatment options. I'm literally telling you, fix all sleep disordered breathing in this short time, but just like highlights. And the reason why I want that to be is I really want viewers to see this and say, oh wow, there are options.
Hmm. Yeah, there are a lot of options. I'll touch on a few of them because there's too many.
So many. Yeah.
So let's start with adults. For adults, there's In my eyes, two options. One is expansion, whether that's actual skeletal expansion or dental expansion to make some more space for the tongue. And then the other is a nighttime appliance, right? A mandibular advancement device or something to reposition the jaw so that your jaw is held forward, your tongue is not falling back, and you're able to maintain a patent airway while you're sleeping. That's only if a CPAP has not been recommended or patient is non-compliant with a CPAP, right? These are all just little, essentially, ways to help alleviate the symptoms that come with sleep apnea. For children, it's a lot more. There's just so many options. I'm trying to like see how I can make it as simple as possible. So for children, the younger you start, the better, because what we do is we use growth in our favor, right? A
Mhm.
child as young as 2 can essentially start treatment. And I just know some people are like, what are you talking about? 2-year-old's not going to even sit in the chair for like more than 2 minutes, right? Um, so at that age, a lot of my recommendations are revolving around myofunctional therapy and the tongue, right? Like using the child's body to stimulate the child's growth. No external kind of things or external stimulation. It's just what our tongues are designed to do. If the tongue is in the right position in a child, it's going to signal the body to grow, right? I need space, make room. Essentially, that's what the tongue is telling the brain. The brain sends out growth hormones during sleep, and then we get our space over time, right? When you see crowding in little kids as young as 2, 3, 4, 5, again, my primary go to is myofunctional therapy. Get the tongue in the right spot, and then let's do treatment. If the tongue is not on board with treatment, anything we do is going to relapse. Any type of expansion I do is going to close right back up. Any type of alignment we do is going to close right back up. We need something to hold it. In traditional dentistry, it's called a retainer. That's why you see so many kids who've gone through orthodontics in their teens. They come back in their early 20s and they're like, oh, my teeth went back,
Mhm.
right? Because it was an external retainer. We're not utilizing our muscles properly. If we
Mhm.
utilize those properly, we train our muscles, you never need a retainer,
Mhm.
right? You don't need something to like put in your mouth every night. Your teeth will be held in place by your body. Um, so, myofunctional therapy for sure, for any kid, no matter how old they are. I just feel like that's my go-to. I probably like say it too much, and everyone gets tired of hearing it, but it's so crucial. It's so important, and it's so easy, right? Like
Mhm.
it's not a surgery. You don't have to sedate the child. You don't have to like do anything crazy. It's something you can do on your car ride to school. Like it's very
Mhm.
simple exercises that a trained myofunctional therapist, with experience and expertise in airway can guide you through. So it's one of the easiest things to do. And then there's so many kinds of appliances, right? Depending on the child, what their needs are, nighttime appliances to help them with nasal breathing, daytime appliances to help stimulate growth, guided growth appliances to help bring the teeth into the right position, and then also, traditional orthodontics as well if they're already have all their permanent teeth. So there's
Mhm.
a lot of options. It's really case by case, but the earlier you start, the better.
Mhm.
With that, I will say the earlier you start, the longer treatment tends to be because we're working at the body space, right? I'm not going to pull out all the teeth to get everything in the right spot, but we're going to go slow. We're going to go as the body grows, and we're going to give the body those signals it needs to kind of, grow for us so that we don't need orthodontics at all once the child is older. That's the
That's that's amazing. That's such a powerful summary. And I think what I love is really leaning into helping the body do what it knows to do.
Mhm.
That's it.
Yeah.
That's really the bottom line. And I love the fact that, what you've talked us through just really reinforces the fact that there are options. Earlier is better because
Mhm.
now, if you can address it and get the face and the anatomy right, then maybe down the line we don't need to deal with a lot of the issues that we're dealing with.
Yeah, absolutely.
Um, I just love how comprehensive your approach is too. So maybe talk us through what it's like, what's working in your practice like. What does that look like? For instance, from that sort of more of the someone just seeking optimal oral health to someone seeking optimal airway and sleep health.
Mhm.
And then what other alternative treatment options you usually offer your patients?
Our focus is really on proactive prevention rather than reactive treatment, right? So we spend a lot of time with patients. Your first visit is almost like an hour and a half, and it's really just a lot of talking. Talking, educating, explaining the options because most people are not given options. It's like, this is a cavity, come back in 2 weeks and we'll do a filling or we'll do a crown and I'll see you in 6 months, right? Um, so, this is a lot of putting the patient in the driver's seat,
Mm,
testing them, putting the pieces of the puzzle together to figure out the why before we say how we want to treat it, right? The goal is to treat, but also to prevent these same problems from happening again.
mm,
So saliva testing is a big one. Getting the gums and oral health in order, assessing tongue position, getting that up to par. We treat with things like ozone. We do a lot of minimally invasive treatment. Um, Ozone for me is like the equivalent of a magic wand.
mm,
Or as close as you can get to one. It helps with a lot of things like periodontal issues, bleeding gums. It helps with cavities. It helps with, help restoring or giving a boost to the biome, the microbiome in the mouth to kind of help the good bacteria out and minimizing the count of the bad bacteria. Um, Things like that. And the focus is really on long term prevention. So, alignment is a big one. The way I do orthodontics is not with the goal of having straight, pretty teeth. That's usually the perk of treatment. The goal is really to make sure that the bite is correct. The
mm,
teeth are in a good, ideal position, meaning we're actually moving the roots of the teeth and
mm,
getting them in their proper position so there's not relapse in the future. A lot of, you know, general dentists get a bad reputation because there's a million ways to treat a patient. But the quick, easy way is just to line up the front teeth, move the teeth so they look aesthetic, but not really looking at where the roots are. What's going on underneath the gums? How are we optimizing not just the position of the teeth, but the patient's health altogether, right? If the
mm,
teeth are properly aligned, properly positioned, the bite is balanced, we're essentially preventing things like periodontal disease. We're preventing any joint issues in the future, and really setting you up long term so that you keep all your teeth for as long as you live. The
mhm,
goal is not to enter that tooth cycle, right?
mm.
Don't go down the route of fillings, crowns, root canals, implants, dentures, whatever it is. The goal is to keep your teeth forever.
Mm. Because they belong in your mouth.
Absolutely.
That's awesome. That's awesome. Well, this has been so enlightening. And I really appreciate you taking time to talk with us. So how can people work with you and where can people find you?
The best place is probably our website, www.thrivedentalwellness.com. We're also really active on Instagram, a lot of informative videos and posts. And we're having an open house coming up actually in October. We do a lot of community events and kind of show up because it's nice to give people this education and background, that they're not used to getting at their dentist. So our open house is October 23rd. It's a Thursday from 3 to 7 p.m. And we will be doing free consults that day. So if anyone is kind of on the fence, thinking if this is the right place for you, this is the perfect opportunity to come ask your questions, get some information, and make that decision.
Awesome. Well, this has been great. Thank you so much. And so we'll put that, we have it scrolling here. We'll also put it in the notes. Thrive Dental Wellness. Thank you so much for spending time with us. So you guys heard it. I didn't say much today, but you could tell airway health, sleep health, There are things, your child is not too young to be assessed. I have children in the first year of life being diagnosed with sleep disordered breathing, being diagnosed with sleep disorders, and treating it early, changing the entire trajectory of the child and their families. I
Mhm.
have seen relationships restored because sleep got better. And so it starts with taking that step of faith to say, enough. I'm tired of suffering. I'm tired of accepting status quo. I'm going to lean in and explore the options that are available. And as you can see, there are multiple options available, right? But the first step is picking up the phone to call, going onto that website to schedule a consult, and then from there we'll be able to direct you on the next steps to take, right? So either you notice that you want to really optimize your airway health, your oral health, seeing experts like Dr. Artani, or you're really saying, I don't even know where to start. Do I get a sleep study? Is it even a sleep disorder from a sleep breathing standpoint or a behavioral stuff? That's where we step in at the Restful Sleep Place, and we'll be more than happy to help out. So you could check out our website at therestfulsleepplace.com, or give us a call 215-607-8297. And until next time, I hope you rest well.